At this point, over a year into the pandemic, we have data. So we know that the rates of anxiety, depression, and eating disorders, they've all increased.
Dr. Willow Jenkins is a child psychiatrist and the inpatient medical director at Rady Children's Hospital.
Personally, I see children every single day.
She says there has been about a 25% increase in mental health visits to their emergency room.
Could be a variety of things, but to bring a child to the emergency room for a mental health issue, obviously it's something that's pretty acute and pretty severe. So our most common reason is suicide, whether it's the thoughts of suicide or actual action.
Dr. Jenkins says early interventions are key for preventing worse outcomes, and for parents that can be simple as talking to your kids a little bit more, especially if you notice something just isn't quite right.
And I know a lot of parents get kind of nervous or unsure of how to have that conversation. So I always tell families, please ask. If you ask, you're not going to make that child think about it more. It's not going to cause them to act. If anything, you'll get more information and potentially even save their life. This is very, very serious.
Rady Children's has a 24-bed inpatient mental health unit, which has been full, and during the pandemic, a new psychiatric emergency room wing opened up.
One of a few nationwide. It's a 6-bed specialized pediatric psychiatric emergency room. So it's staffed with a child psychiatrist, specialized nursing, social workers. Everything is geared to supporting the mental health of youth.
Jenkins says there are a number of reasons for the increase in visits.
The fears of getting sick. At this point in the pandemic, we've had children that have lost their parents to COVID-19. So there's grief and there's loss. And then there's obviously the indirect effects of the pandemic. So this is relating to school closures, being socially isolated, being away from friends and peers.
She says ongoing racial injustice issues and political tensions are also a factor, plus the stresses of parents who may have lost their jobs.
So warning signs for mental illness in youth. So those usually are if you're seeing your child become more withdrawn, not hanging out with their friends as much, not doing things they enjoy. If they're becoming more irritable, more angry, that's a key sign of depression in children and youth.
Jenkins says one of the most common fears from parents is if they think there's something wrong and they alert doctors, their child will automatically be put on drugs. But she says most mild to moderate cases can be handled with therapy.
Nothing is done without a full evaluation, talking to the family, reviewing all of the options.
San Diego County data shows in 2020 there was not an increase in youth suicides when compared with the previous few years. Anyone in crisis should call the National Suicide Prevention Lifeline at 1-800-273-8255 or visit their website, suicidepreventionlifeline.org. Matt Hoffman, KPBS News.